Another service that we offer that sets us apart, way apart from other dental offices, is zirconium implants. We are one of 2 dental offices in the state of Utah and about 40 to 50 dental offices in the United States that offer this service. Zirconia, the actual implant itself is made up of zirconia oxide, which allows it to integrate to the bone. The process involves drilling into the bone, creating a pilot hole, pilot space, to receive this portion that you see, which has serrations, to then place down into the bone. Once that's in the bone will go around this and form an actual zirconium oxide layer where the bone actually fuses to the implant. Once we've determined which implant would be appropriate and how much bone is available, then we go through the diagnostic phase where we gather more information, make models of the teeth, and plan exactly where the implants will be placed and which teeth will be placed upon them as temporization or temporaries. Then we're ready for the surgical phase where we actually go in and place the implants, and typically an incision is made, pilot hole made, a hole drilled into the bone to create space for the implant, and then placement of the implant. Sometimes sutures will be placed to close the tissue tightly, snugly around the implant to eliminate or minimize the possibility of infection. We will also use a low-level laser after surgery, separate from our water lathe. This is a laser that purely stimulates regenerative capacity of the body. It does no cutting, it simply decreases inflammation and stimulates the body's ability to heal. Once the implants are placed, the sutures are placed if necessary, the laser's been placed, then basically patients will heal depending on their specific phenotype or how they heal. Some patients, the next day, they won't have any pain. Other patients will take up to 2 weeks, having some soreness, some tenderness, as would be expected with a surgical site. Then after that, we look at how we're going to permanently restore those implants. Our standard practice is to place a crown on the implant called Emax, which is a dilithium silicate material. Again, we don't use any metal, and again, this is a very biocompatible material. Looks like it grew from the tissue. After that, treatment is typically completed with some type of nighttime appliance to prevent any clenching or grinding on the implant, as those types of forces are not conducive to implant success.